we go. Thanks everyone for joining us. As Sarah mentioned, today we're just going to be talking a little bit about understanding dementia and just a review of the caregiver's role, as well as some other just general information in regards to cognition. My name is Abby Williams. I am a speech language pathologist, and I've been working in a variety of geriatric-based settings for the past 17 years. For those that don't know, speech language pathologists typically in the geriatric or adult setting, we do work with older adults on their cognition. So that is part of our scope of practice. I am now the Director of Strategic Integration at Mansbach Health Tools, which is home of the BCAT.
And I'll jump in and introduce myself. Hi, everybody. My name is Lynn Young. I'm also a practicing speech language pathologist. To Abby's point, part of our role and my role throughout the years when I was a practicing clinician was to do assessment and really understand where folks fall on the cognitive continuum to be able to generate treatment goals and kind of meet those individuals where they are with working on the skills they needed to be able to function in their home setting, whatever setting they find themselves in. My current role is Vice President of Operations at Mansbach Health Tools. So I do a lot of things like this, where I'm doing education and training out in the community with folks that are also working with older adults. I also serve as a member of the ASHA Professional Development Committee for the Special Interest Group 15, which is the gerontology group, and have presented at the local, state, and national levels. I'm going to take everyone through the front half of the presentation, then I'm going to kind of pass the baton to Abby in the middle, and she's going to take us the rest of the way. So I'm just going to get started. You can see here on our objectives slide, these are sort of our key points that we hope everyone has some good walking around knowledge as we end the presentation. We're going to talk a little bit about cognition and, why are those underlying thinking skills really important? We know that there are folks across the cognitive continuum. We may have older adults that are normally aging, so they have really good cognition. They're able to complete all those independent living tasks. They're able to sustain and maintain their current living environment. We also have folks that may have mild or more moderate impairment all the way through and including a diagnosis of dementia. And that's really different if people have a progressive medical diagnosis that's going to impact cognition. We oftentimes need to understand where they are on the cognitive continuum so we can meet their needs and make sure we're customizing all of our care planning and approaches to align with what they're able to do and their ability level. We'll be talking a little bit about communication approaches. We know as conversational partners and caregivers, communication is important, right? Being able to have those older adults convey their needs, their goals, but also to be able to deliver information in a way that they can understand. We're going to talk a little bit about the Dementia Journey, a navigation manual for families, which is a book that was authored by our team that is a really nice resource and supplemental tool that some of our family members really enjoy, just kind of having a little tutorial on what to expect throughout the dementia process. And then we're going to talk about brain health and what that really means, right? We're all sort of working on our wellness and our health throughout our lifespan. We focus a lot on, I think, the physical elements, staying active, right? Maintaining our exercise regimens, healthy eating, but brain health is another piece of the puzzle. So how can we support brain health? And if someone is going through a transition, whether it's from one living situation to another, or if they're having a transition with their caregiving needs, what happens during those transitions in care, and how can we make sure folks have some kind of cognitive brain health program that's supporting them throughout? Next slide. So let's skip over this. So why does cognition matter? Why is this piece of sort of overall wellness so important? Well, at the BCAT, we think of cognition as a vital sign, right? It's at the center of everything we do, just like blood pressure and other vital signs. It gives us a measure of how someone's going to be able to manage out in the world, right? We know that other vital signs are predictive of illness or infection. Cognition can be predictive of functional performance. So cognition is sort of an umbrella term. It covers a lot of ground. When we refer to cognition, we're really referring to sort of the group of skills that are needed for everyday functioning. So when we think about the areas listed there on the left, attention, memory, problem solving, reasoning and judgment, and the ability to organize, we know that if there's a deficit or some kind of decline in one of these areas, it often shows up in an everyday event. So for example, if someone is having difficulty paying attention, they may start to struggle with reading their prescription label when they set up their medications. They may start to get the number of pills per day and the number of times per day mixed up, right? They may not be able to follow the directions on a cooking label or a recipe. So we start to see, people leaving the stove on, people leaving the water on, things like that. For memory, again, memory and attention go hand in hand. So if you can't attend to detail, it's really tough to remember the details. So again, do you remember that your pills are at 9 o'clock and again at 6 o'clock in the evening? What if you go out for the day or you go somewhere? Are you planning ahead, taking them with you? Problem solving, what do you do if there's an emergency? If you don't feel well? This just happened to an older adult in my family. If somebody sends you a text message that says your account's been compromised, verify your account information here, and they want you to put your checking account, your social security number, and your, birthday into this random website. Can you problem solve and recognize things that might not be, good choices? Reasoning and judgment. We do this every day when we're making decisions around our healthcare, right? Understanding pros and cons to maybe some kind of treatment intervention. How do we make safe choices? What are those decisions that we make? If my light bulb goes out, should I wait for someone who's coming to visit tomorrow to help me change it? Or should I jump up on a chair and try to do it myself? And then, organization and planning skills are really sort of the building blocks for a lot of functional tasks. Just think about setting up a medication box and all of the moving parts, right? Reading the label, recognizing the dosage, making sure we put the dosage in each, Monday, Tuesday, Wednesday, Thursday. Do we put so many pills in the morning? Do we put so many in the afternoon box? Keeping our calendars organized. I mean, that alone is a monumental challenge, I think, for all of us, right? Keeping track of birthdays and events and doctor's appointments and anything, the due date on our bills. So having these sub skills are really important. Next slide. So when we think about cognition and sort of the stages of cognition, we could have folks across this entire continuum. People who are normally aging often have very, subtle changes, but it's not always an issue for concern. They're still functioning. They're still doing all the tasks that they need to do. They may occasionally misplace their glasses or, have some memory issues, forgetfulness. Maybe they forget the name of someone, but it's not a call to action in the sense that they're panicking about it. It's just, something to be mindful of. We all have changes as we age, but so far not really impacting daily and functional tasks. As we see folks who have what's called mild cognitive impairment, this is where beyond normal aging, people primarily struggle with memory and those high-level executive activities of daily living, medications, finances, appointments, managing a schedule. Dementia is a little bit different in that it is definitely not part of normal aging. It's a secondary diagnosis, and it affects not just cognition, but lots of other things: mood, behavior, personality, motor, language, functioning. You can go to the next slide. So it's really key for caregivers to know, where is this person that I'm working with across all of these cognitive levels? because they're going to have different needs, they're going to have different strengths, and they're going to have things that maybe we need to compensate for or be mindful of. So having a screening tool available, in your sort of professional bag of tricks is sometimes nice to have, because a cognitive screening tool can tell you if there is a cognitive impairment, right? Identifies the presence of a change from normal, and it will also tell you the severity. So you may see folks across this continuum, and you may want to know, is this, this mild memory impairment just part of normal aging? Is this really a mild cognitive impairment? Or is this maybe a precursor to something more severe with a more moderate impairment, like something like dementia? Generally, with normal aging, we see, no significant memory concerns, no significant changes in cognition, driving, managing their home, their finances. These folks are still, shopping and cooking and cleaning, occasional forgetfulness, but it's not, frequent, and it's not a normal occurrence. Next slide. For folks with MCI, and mild cognitive impairment is sort of its own sort of medical diagnosis or terminology that sometimes physicians or primary care practitioners will use. And we know that persons who start to demonstrate symptoms of mild cognitive impairment are often 5 or more times more likely to convert to Alzheimer's disease. So sometimes this is sort of the in-between between normal aging and dementia. If somebody's cognition is aligning with an MCI, they are most likely having trouble with instrumental activities of daily living, higher level things like getting their taxes done, balancing their checkbook, writing out their bills. There is a higher conversion rate when folks have memory problems. That is often a symptom that they may convert to dementia, although they don't always. These folks may start to require more support, and sometimes it's a very subtle change from normal cognition. So we may want to be on the lookout for that if these folks are demonstrating some of those symptoms. Next slide. Dementia, as I mentioned earlier, is really sort of a unique and different consideration. It's a permanent and progressive loss in someone's abilities to make new memories and learn information. So this is something that's going to continue to get worse over time, although some of the dementias, the progression rate is different or slower from others. Dementia, again, is sort of an umbrella term. It refers to a cluster of symptoms. There's many types of dementia. There's many causes. We often hear about Alzheimer's disease. It's one of the most common types. It accounts for about 50 to 70%. And we always see cognitive changes with dementia. Next slide. So what are some other indicators or red flags that you might start to notice or families might report that might warrant further assessment, maybe connecting back with the primary practitioner if we suspect someone is presenting with dementia symptoms? Lots of different things. No two things are the same in two different individuals, but these are some general guidelines. We may see, again, that change in mental functioning. And it's significant enough that it's impacting day-to-day tasks. 2 or more of the following abilities: memory, so remembering new information, that would be things like names, what they had for breakfast, where they went this morning. Often we see changes with language, and that could be both the receptive or the understanding of information, as well as their ability to express themselves. Sometimes the longer the message, the harder to understand. So 1-step directions are easy. 2- and 3-step directions might be challenging. Making sense of the visual spatial world that they live in. So sometimes, things like symbols become difficult. Certainly that connects well to driving, being able to interpret information quickly and make decisions around it. Executive functioning really covers a lot of skills: reasoning, planning, judgment, problem solving. It's kind of the CEO of the brain. It organizes and plans a lot of the things that we do. And there are a lot of models out there where you can sort of what they call stage dementia. So some of them are based on assessments. Some of them are based on presentation, but I think it's helpful when you're thinking about folks across a continuum to consider that someone may have a diagnosis of dementia, but their symptoms may be mild, they may be more moderate, or they may be more severe. Next slide. So if we know that somebody is presenting with cognitive impairment, whether we've done a screening tool, families reporting it, we've observed some changes ourselves, having a comprehensive assessment can often be helpful. We know that cognition and function go hand in hand, so being able to perform those activities of daily living. We also know that cognition and safety can go hand in hand. So we don't want anyone to be unsafe, making poor decisions, thinking they can go out in the middle of the night for a walk around the block, taking the car keys if they're not safe to drive. So having more information around someone's cognition and their cognitive skill set can be really valuable in helping the whole team, the older adult, their family member, caregivers, healthcare professionals, their primary care physician, sort of pull together and determine what can we put in place that will support this person, living in their current environment for as long as they can. We want them to age in place. We want to provide the supports around that to make them successful. Next slide. One example of a cognitive assessment tool battery is the BCAT test system. There are certainly other cognitive batteries out there. This particular one comprises 6 unique assessment instruments. It has a cognitive screening tool, a full cognitive assessment, 2 practical judgment tests, a screen for mood, and a tool designed specifically to assess persons who have more moderate cognitive impairment and to determine sort of their baseline so that we can track any changes over time. So this is one sort of tool that's out there to be thinking about. Certainly there are others, but having objective measures allows, this group to really be able to put a number to it, to identify where on that continuum people fall, and then to be able to reassess later if you need to screen somebody every 6 months, or if there's an event, right? If someone leaves the water on in the bathtub and it overflows, or the stove and there's a little fire, maybe it's time to reassess. So having an assessment tool available can be really helpful. Next slide. And then having the information available to take what you learn or what you know from their cognitive assessment and to be able to sort of crosswalk that or apply that so that we have predictive information, right? If someone tests out as normal, great. We expect them to have very minimal, if to no functional deficits. Independent living should be very manageable. They may have some subtle complaints, but we should be expecting them to be successful in that independent setting. By contrast, if someone has declined a little and they're presenting with those mild cognitive impairments, now we're starting to see some changes. They can still do daily things like bathing, dressing, grooming, but those high-level tasks are impacted. A lower score at the lower end of this range, of this mild cognitive impairment range, may be suggestive of needing more support. Maybe they need someone to come over throughout the day, someone to help them move through their daily routine, make sure they eat, make sure they're drinking, make sure they're taking their medications, and so on and so forth. So this is just one way to look at staging. The GDS and FAST that you see in the middle of this graph, as well as the Allen Cognitive, those are both different staging tools that exist for dementia. Some practitioners really like those because it helps sort of create a framework of what expectations are for the early, the middle, and the later stages of cognitive decline. Next slide. Understanding the cognitive levels. So I'm going to hand it back over to Abby here, and she's going to talk a little bit about what we do with all this information.
Thanks, Lynn. So just building off of what Lynn has discussed, there's these different stages of cognitive impairment. So now what are we supposed to do with that information as caregivers, as families, as any individual that interacts with the older adult with these cognitive impairments? It's really important that you understand, what the cognition looks like at each of these stages. So with MCI, mild and even earlier moderate dementia. So those individuals that are kind of at the earlier stages of the dementia continuum. And even in the middle, some of those moderate stage individuals, they may be able to learn new information. So what this means is you might be able to tell the person, albeit it would have to be, with some repetition, maybe with some other compensatory techniques, but they may be able to learn some new information. So for example, if you say, if they're living in, an assisted living facility and at lunch, there's no more chicken noodle soup. The chicken noodle soup is not on the menu any longer. So this individual may be able to learn, okay, chicken noodle soup is no longer on the menu. I'm not able to order this anymore. That may, become part of their memory over time. Again, it might take a little bit of repetition and a little bit of understanding, but they will be able to learn some new information. If the individual is a later stage in the dementia continuum, that new learning may no longer be present. So you could keep saying every day, I've told you there's no more chicken noodle soup every day. They just don't have the ability to be able to retain that information any longer. So those two distinctions are very important to know, because we all have encountered, if you work with an older adult or if you encounter an older adult with cognitive impairments, there are those folks who just cannot learn new information. They just cannot understand it and learn new information. And so by repeating it over and over and over, it's just going to frustrate you as the individual talking with them, and it may frustrate them if it keeps happening over and over. So it's just important to understand that component. So what would happen if we could increase cognitive functioning for those that can still learn new information, or if we could slow down decline? What could happen if we're able to do that? Well, they'd be able to maintain their independence for a longer period of time. It could certainly promote aging in place. It would be able to maintain, the individual would be able to maintain functional performance for a longer period of time. It would improve their mood functioning if they're not going to get worse, and improve their overall well-being and improve their meaningful engagement. So these are just some considerations of what could happen if we were able to increase their cognitive functioning. So we're going to talk over the next few slides about just that, about abilities to improve their cognitive function, as well as the ability to slow down the cognitive decline. So we have what's called cognitive reserve. And what this is the brain's ability to resist that cognitive decline, especially with Alzheimer's disease and the related dementias. So it's really the brain's ability to create these workarounds. So having a nice cognitive reserve already there kind of helps buffer against that further decline. There's also neuroplasticity, which is more of, we're just going to touch on the surface of this, but it's just important for you to hear this and to know and understand. For those folks and those individuals with, again, that earlier stage of dementia, they have the ability to learn new pathways, to learn new information, and that's through this neuroplasticity and building a strong cognitive reserve. So this is just some statistics about neuroplasticity, that the normal adult may have 100 billion neurons. They're connected by these synapses. There's a lot of these synapses that are happening, and it changes across the lifespan. So again, to preserve those skills and abilities, the brain, through neuroplasticity, has the ability to change or adapt through experiences. This could be through therapy. This could be through doing the same thing over and over. This could be, learning a new activity. This is certainly a lifelong process and can happen even into older ages. People with dementia are still often capable of some neuroplasticity. So this is important to note, that even though they have dementia, if they do have that new learning capacity, then they have the ability to create these new synapses and these new pathways. So there's two types. There's this functional plasticity, and then there's structural plasticity. So in functional, the brain moves specific functions from a damaged part of the brain to an undamaged part of the brain. So this could happen if the patient has had a CVA or if they're recovering from stroke, and we know that there's a specific damaged portion of the brain's able to figure out new pathways to still learn new information. With the structural, the brain changes or it enhances its physical structure. So it actually produces more of the dendrites as a result of specific learning or cognitive activities. So by increasing the brain's ability to learn new things or to improve function, it actually enhances its physical structure. So improving working memory efficiency, we're going to talk a little bit about working memory. It's the ability to attend to information in order to do something with it. So that's just something to keep in mind as we talk a little bit further. So keeping in mind the ability for cognitive reserve and for the neuroplasticity, there are certainly tools available that promote this neuroplasticity and to help build cognitive reserve. And in order to do this, the individual would have to leverage their preserved skills and work on their working memory capability and limitations. So speaking of working memory, so a person with normal cognition has the ability to, their working memory efficiency, so they're able to listen to information and hold it for approximately 25 to 30 seconds, which is quite a bit of time. For those individuals with an MCI, it goes down to about, or a mild dementia, about 8 to 10 seconds. So it's much less. Someone with an amnestic MCI, so an amnestic MCI means the primary concern is memory. That's anywhere from 10 to 20 seconds. So again, you're going to say something and they're only able to hold on to that information for 10 to 20 seconds. For an individual with mild to moderate dementia levels, it's only approximately about 5 seconds. Anything less than that moderate, it's going to be just immediate. So if you think about this, if someone has a mild to moderate dementia, their working memory capacity is only about 5 seconds. So if you tell them, an instruction, or if you're giving them some information, it's important that you keep that in mind, that they're only able to hold on to that information for a very short period of time. And if you get interrupted and you have to come back, it's important to know that you might need to repeat yourself because that information could be gone by that point. That's just their ability from a working memory standpoint. So what are some general communication strategies to use when speaking with someone with dementia? And this can be, it doesn't matter the stage. It might be something that you'd have to emphasize for later on, but any individual with dementia could benefit from being communicated with these strategies. You would want to speak slowly, but not too slow. Think of that working memory capacity. If you speak too slow, then it takes much longer to speak. And then it's going to be more difficult for them to remember what you said in the beginning. So you want to speak slow so they can understand you and they can fully process it, but not too slow. You want to speak directly. You don't want to, jump around topics, go off on tangents, talk about things that are not relevant. You want to speak directly and to the point. Minimize background noise. So a lot of times older adults, they might have the radio on or they might have the television on, and they might be trying to have a conversation with all of this noise. By reducing that background noise, it's going to make it so much easier to just be able to have a focused conversation. Be direct and brief. Again, don't bring in all this other information. Say what you need to say or give the specific instructions and try to keep it concise. Repeat information if necessary. It's okay to repeat the information. That's how they're going to understand. If it's something extremely important, you may want to say the important component and then some, follow-up details, and then that important component again. And then when you're leaving, don't forget, and that important component again. So these are just a few general tips for communication for, when talking with someone with. So for those with a mild cognitive impairment or an MCI, many individuals at this stage can certainly live alone. They may need some support because they are losing some of their cognitive capacities, but for the most part, they can live alone, maybe with just a little bit of additional support or check-ins. For certain types of MCI, like as I mentioned, the amnestic, the memory deficit could be the most common impairment. However, there are other types of MCI where there's other cognitive processes that are other cognitive domains that may also be impaired. For example, they might have executive functions, which controls the planning and the organization and the reasoning. That could be a primary area that is impaired, or it could be mixed with the executive functions and the memory. So there's just different types of MCI. And again, their working memory capacity, it's about 8 to 10 seconds. So keep that in mind when having a conversation with someone with the MCI. For the mild to moderate dementia, individuals at this stage, they may be able to live alone with more support. So a lot of times if an adult does have a mild to moderate dementia and they have their scheduled routines and they have their routines, that's when they are able to live alone. But if something interrupts that routine is when they're going to need more support. Even if they do have the routines, they still may need, check-ins from families, either a daily check-in or a twice daily check-in, or maybe in the early mild stage, every other day check-in. It could be a phone call, could be a visit, could be setting up the meds, setting up the meals, just kind of depends on the individual and their situation. Individuals with more of a moderate dementia may even need more support in their home or in a residential care setting. So they might need to be in an ALF or memory care, etc. And think about their working memory. It's approximately 5 seconds. So again, if you have a relative with a mild dementia or moderate dementia, and if you say, Mom, don't forget, I left you lunch, it's in the fridge. And then you talk about something else. And if they didn't fully, if you didn't give them a chance to really process it or tell them to write it down, or if you switch topics, there's a good chance that information is going to be gone. So again, feel free to repeat yourself and understand that working memory capacity. Speaking in short sentences and being concise and to the point is going to be very effective when speaking to individuals at this stage. And just a note, so after moderate is going to be those individuals with severe dementia, which is the end stages or late stages of dementia. Individuals at this stage, they will need the 24-hour care. Communication is going to be very limited, both verbal expression, so they might not be able to verbally express themselves, and they might not be able to understand. So it just depends. Everyone, communication, as with all other functional abilities, does diminish throughout that dementia continuum. So meaningful engagement, it was mentioned earlier. It's just since we're talking about the caregiver's role in communication, it's important to discuss meaningful engagement. So what is it and why is it important? So meaningful engagement is very important for those individuals with a moderate to later stage of dementia. It's really the need or desire for a meaningful activity. It's really essential for all humans and as part of human nature. Those individuals with a dementia, they don't have the ability to seek the meaningful engagement. So they don't have the understanding to say, oh, I know that I want this and I know I need this, but I don't know how to go about and finding it. So by offering them meaningful engagement opportunities, it just has a greater positive health outcome, both physically and psychologically. By increasing their ability to engage meaningfully, there's less of a need of utilization of psychiatric medications. So what are some examples of meaningful engagement? It's really activating old memories to engage them through pictures and conversations about familiar people, places, objects, and events. Activating old memories certainly provides a foundation for engaging participants in directed conversations to improve cognitive functioning. And it just helps promote spontaneous conversations, sharing of memories, and engagement. So really taking a focused topic of interest and engaging that person meaningfully through conversation, looking at pictures, asking them questions. It might be singing songs. Those are all examples of meaningful engagement. So a little bit more about the caregiver role. So we're going to go through just some caregiver tips. So as a caregiver, and a caregiver could even just be someone that sees the older adult on a daily basis. Caregiver can be a broad role. It could be someone that actually cares for the individual day in and day out. It could be someone that just works with the individual, but maybe not directly. Maybe they just see them. But it's important to know this information if you do come in contact with the older adult. So understanding the cognitive status, knowing where they're at on that cognitive continuum, understanding the working memory capacity, as we talked about, and relevant communication strategies, encouraging meaningful engagement, and helping to support a brain healthy lifestyle. And this goes for both the caregiver and the older adult. This is how we're going to age in place, is by having brain healthy lifestyles for everyone. A little bit about the dementia journey. So this is the dementia journey. It's hard to see, but it's a workbook essentially. If you have a family member or a loved one that you know that has just been recently diagnosed, it's called a navigation manual for caregivers for a reason. It essentially provides caregivers with information. A diagnosis of dementia can be overwhelming, and there's so much information out there, but at the same time, you don't know where to go to find that information. This is a nice, concise booklet that provides you with, terms that you might need to know, types of dementia, things that you're going to hear, the different stages and what to expect. And it comes in a format that's lightweight, it's thin, and you're able to take it with you to appointments. So if you're someone that goes to appointments with a person who has been diagnosed with dementia, you can take your book and then you could write in notes, into the margins, and you can ask the doctor for any kind of tips. At the end, there's also a section for notes. So just a little bit about that book. So it is written by 2 dementia experts. And again, the purpose is to help guide family members and caregivers on navigating that process of having a loved one with dementia. It's really ideal for family members or caregivers who are close to someone with dementia. Just helps understand more about the dementia process, about the progression of the disease, and can just help guide caregivers in making difficult decisions. So if you want to purchase, again, this will be sent out in a PDF. Here's the QR code and the website if you're interested in checking it out. A little bit about brain health. So the importance of brain health. For those individuals with a cognitive impairment, the goal of brain health is really to help strengthen the brain's defenses and protect against further decline, and then just maintaining brain health and cognitive wellness. So for those normal aging adults, to maintain their current cognitive functionability, help building that cognitive reserve. For those with some memory and cognitive impairments, it's by participating in brain healthy activities and lifestyle. It helps to maintain their independence and age in place and successfully complete their functional tasks that are needed for day-to-day life. For those who might have more of a mild or moderate cognitive impairment, it's going to provide cognitive stimulation and or meaningful engagement and help reduce any kind of negative behaviors. So brain health, again, is for everyone. We do have, as part of a sister program to the BCAT, it's called the Enriched Brain Health Program. And there is a website called that all of our brain healthy program essentials are on. It's basically a web-based program, and it's used by the older adult and family members and really anyone to learn more about brain healthy lifestyle choices. There is a free mood screen. There's a free Enrich calculator, which really looks at your lifestyle. And there's also a memory screen. So this is all free for anyone to use. And then if you participate in the screens, it will provide you with specific action plans that help promote cognitive health and wellness programming to support that cognitive stimulation, and just to help buffer against any kind of decline. So there's the website. It's www.enrichvisits.com. There's also on the Enrich website, you can get a membership, which provides access to free resources, such as the brain exercise of the week. It's emailed directly to your inbox every Monday. If that's something that you have an older adult that's looking for, more cognitive stimulation, they could sign up for the brain exercise of the week. There's also health tips and educational information that is emailed by signing up for the Enrich membership. We also offer a Family Matters interview series. We do have a YouTube channel, the BCAT YouTube channel. The primary goal of the Family Matters interview series is to help just families learn more about how to cope with their loved one with a cognitive impairment, and help them meaningfully engage appropriately. So basically what this is an expert from the BCAT Research Center or other expert healthcare professionals. They're interviewed monthly, and the interviews last for about 20 minutes, up to 25 minutes. And they're free to view on the web or on our YouTube channel. You're able to go on and view all the old interviews, as well as this is just a flyer of the upcoming interviews that are going to be happening in the second half of 2023. Okay, so now just wrapping it up, and we are happy to answer any questions you may have.
Thank you so much for the presentation. And again, we'll be sharing those slides and more information. Yes, your contact information, just about to ask for that in case people want to email you directly, but really appreciate the educational content you provided for us today. I've been looking at the chat and I don't see any questions in the chat, but would love for any folks on the call today to go ahead and put your question in the chat, but also feel free to unmute and ask a question. So we'll give a few minutes for that. Okay, so one question here. Can you give the website for the manual?
Yep, it will be in the PowerPoint that'll be sent out.
Okay, sounds great.
Oh, thank you.
Yeah, thanks, Lynn. That's perfect. Yeah, excellent presentation and very informative. Thank you.
Mm-hmm.
Yeah, the Family Journey book would be under the bookstore tab on that website. I know Abby also covered on that website the free membership for the free exercise of the week and some of those educational pieces. That's also available on that same site.
Great. Okay, well, I don't see any other questions. We will certainly get all this information out. And I encourage anybody on the call, as you look over the information, look over the PowerPoint, share with your teams, this recording as well, that you certainly reach out to Abby or Lynn for any questions or comments that you may have. Otherwise, email me and I'll connect you with either of them. But again, Abby and Lynn, thank you so much for joining us today. Really grateful for your time that you've had with us. And again, thank you all for joining us on the call today. As a note for next month, our conversation will be on depression and serving older adults who experience depression within late stages of life. And so really enriched conversation that we'll be having next month. I will make a note and I'll put it in big, bold letters when I send out the reminder for this call. Again, we meet on the third Wednesday of every month, typically at 12 p.m. Eastern Standard Time, but it will be at 11:30 Eastern Standard Time. So it'll be a half an hour early next month. So I'll be reminding folks about that as we get closer. But looking forward to having you all join us again next month. And until then, we'll see you later and hope you have a great rest of the summer.
Thanks, everybody,
Thank you.
for the opportunity. Take care.
Bye.